Hello, everyone. My name is Chris Bundy, and I'm a professor of health psychology or behavioural medicine based at the University of Cardiff, South Wales. I wanted to talk to you a little bit about shared decision making. My presentation at the EADV was focused on how shared decision making can help patients to take more control in the consultation and to help better self-management of patients. We hope that this improves motivation, but adherence, but we don't actually know because there are very few studies that have looked at shared decision making in terms of adherence. There are some, but not great quality studies so far. So why would we encourage patients to be involved with shared decision making? Because we know that if people are more involved and active in the process of their management, the health outcomes tend to be better. Whether that applies in psoriasis and psoriatic arthritis, we don't have great quality of evidence so far, but we do know across other long-term conditions that that's a finding. Which patients should we involve with shared decision-making? All patients, particularly if patients are being introduced to new treatments or their treatment options are changing. That's the point at which we would encourage you to involve the patient in their decision-making. And what does it look like in practice? It's a three-stage process where initially you help patients to know what the choices are. Preferably, you would give patient a choice from two positives, two or more positives. I don't think it's helpful if you give patients a choice between one thing that is entirely negative and something that is unbalanced and wholly positive. Really, this is where there is genuine lack of understanding about where the best option might lay. So for you as a clinician, if you present two positive options and help the patients to talk through the costs and the benefits of all of the options, then the decision that is made at the end of that is likely to be better. The second step is where you provide options. So you give choice and you provide options. So helping the patients to understand that this might be the best decision for you at this moment in time. But of course, there is this other decision, which in the future, we might want to revisit and we might want to have a look at the benefits of you taking that decision further down the line. And then the final one is where you've made the decision with the patient in partnership, but encouraging the patient to understand that they can revisit that decision at any time, that it isn't just a one-off decision, high stakes, you make the decision now, forever, hold your peace. It's not that kind of a process. It's this, we have decided today that this looks like the best option for you at this moment in time for these reasons, A, B, and C. But of course, we can go back over some of those processes and we can revisit this in the future. So helping the patient to realize that you are working with them in partnership to come to the best decision, but it's not just a one-off event. So I hope that very quick snapshot has helped you to see what it might look like in the consultation. I think the most important thing is that you prepare the patient. You say that we are going to look at some options for treatment today, and I'll help you to think through those options. And then hopefully at the end of the consultation, we will come to a joint decision. So preparing the patient, taking them through that three-step process and reminding them that you're working with them in partnership will hopefully lead to a better health outcome. But as I said right at the top of this, we need good quality studies to demonstrate that the health outcomes are better from shared decision making. So thank you for listening.